right now, let's talk about what's going to be happening this winter, because I keep seeing more and more people wearing their masks in the supermarket, on the trains, on the buses, and we've seen over the weekend, reports that cases of COVID are going up, including in hospital. Do we have anything to be worried about when it comes to either catching COVID or new variants, or indeed what they might do to us because of COVID being cases going up? Let's talk to Professor Carl Heneghan. He's the Professor of Evidence-Based Medicine at the University of Oxford. Good morning to you.
Good morning, Julia.
Thank you very much indeed for joining us. I noticed yesterday morning that the most read item on BBC website was about COVID cases going up and an explainer, which was an unusually sensible and sane explainer, and explaining about the number of people in hospital with COVID. There is no doubt at all COVID cases are going up, but we would expect that in September, would we not?
Well, interesting. Let's have a history lesson. 3 years ago, they went up very similar at this point. But at this point, 3 years ago in 2020, we ended up with the 10 o'clock curfew, the rule of six, and by October the 14th, we were in the tier system. This time round, I think we've started to learn how to behave and how to act accordingly. What we've seen is the major way of looking at cases is through hospitalizations, because we're not doing the ONS infection survey and everybody's not having tests. And they've gone up to about 3,000 people in hospital. The major people in hospital with problems are over 85s. All of the young people, there's no increases in intensive care admissions. Yeah. And also, we've still got this significant problem with a lot of people still catching it in hospital. So what we're seeing is what we'd expect with the seasonal rise at this time of year. The other infection that's going up is rhinovirus. So lots of people with young children at the moment will be getting the colds and the illnesses.
I think that's what I've had for the last 3 weeks and cannot shake. The entire office has gone down with it.
Yes. Now, interestingly, what's happened is there was an extraordinary in the Telegraph yesterday by Jenny Harries, which basically said,
just explain who she is, because she was a key figure in government policy tackling COVID and lockdowns, and stood at the podium at those press conferences with the Prime Minister at the time. And she's now, was it head of the Health Security Agency?
Yeah, she's head of director of the UK Health Security Agency. So when she speaks, I hope she understands her words have a lot of gravity and a lot of importance. But remember, next week is the COVID inquiry setting up again. So I wonder if this is an interjection to start.
But what did she say that was crucial?
I'll give you the exact. What we saw with Omicron and later waves of the pandemic, and even now, is that people are good at watching the data and they will take action themselves, says Harries. You can see it in the footfall going down. People actually start to manage their own socialization, and the waves flatten off and come down. So next time, don't fall off your chair, Julia, we will be more like Sweden.
Yay!
Without the need for legislation. There you have the inquiry finding. Full stop, done.
Yeah, but we'll be more like Sweden. So we'll follow British pandemic planning and World Health Organization pre-COVID pandemic planning.
I think what the problem here is, within the intervening years, under the pressure, our politicians panicked, and under that panic brought in legislation that wasn't fit for purpose.
No. But we see this. But we see this in the media. I can see, some of those popular news websites. They'll be sort of going, big cases, big number of cases rising, huge number of cases, and you're talking about, a few hundred to a few more hundred. Even when they look at, 3,000 people in hospital with COVID, I think only 1,000 of those are being treated for COVID. Other than they tested positive. When you go into hospital, you're tested for COVID. I don't know why they're bothering to do that anymore, frankly. And then they found you've got COVID. They're not actually ill with it. They're not got a problem with it. Or there's someone who's been in COVID, been in hospital for ages, and they've caught COVID in hospitals, because that's where most people catch it who are elderly. I mean, there just needs to be more responsible reporting, doesn't there?
Yes, I think responsible reporting. I am concerned about something, though, going into winter, is I think we will still end up in the NHS winter crisis. I think we're more...
Of course we will. We have one every year.
Yeah, we're more poorly prepared. We've not got those extra beds we need. As we go into winter, we've got 7.7 million people on the waiting list. Many of those people will be unwell and not receiving the care they need. So I think as we go into this winter, we're just as underprepared as we've always been. We need to look across Europe at our neighbours, because they do not have this crisis like we do, and ask questions about the services and the resources we've got in place, because this is where it'll come this winter. And you're right, then there'll be call for masks, social distancing, intervening, because we'll end up in this situation where they say the NHS can't cope again.
Absolutely. Carl Heneghan, Professor of Evidence-Based Medicine at the University of Oxford.